Well, thank you so much for inviting me, and I've been looking forward to this. And so we're going to start off with a quote, and I want to give you my interpretation of it. You probably can have your own. We don't see things as they are, we see them as we are. And one of my intentions about this presentation today is to help you see through your eyes. And we'll get more into that, but I want you to have ownership of your eyes and vision. Now, in this next quote that I put up, the eye is the window to the soul, but it's also the mirror of the body. And today I'm going to connect the dots on how our eyes affect our metabolic and endocrine health, and I'll get into that in a few minutes. The title of my presentation is called The Eyes Never Lie: What Your Vision Reveals About Your Health. And in the upper left corner is something called Functional Vision Integrative Body. And that's the method that I'm using now to teach practitioners all the things I've learned. I've been at this for about 40 years, and we started a practitioner's training last year that's actually open to non-eye doctors. There's a way that people can use this method and they don't have to be eye doctors, and they can really help their clients. And in the lower right corner is me reading one of my books, my latest book, Vital Vision, and I'll talk about my books at the end of the lecture today. But I thought I would start off about the question that I get a lot, and that is, how did I get into this? How did I get into this uh, optometry specialty? Well, it started when I was about 8 years old. I was diagnosed with a learning disability, and my parents took me to a lot of different professionals. I grew up in a family that really stressed reading and intellectual thinking, and I couldn't read. I didn't know how to read. So we ended up, after visiting several different professionals, at an ophthalmologist's office. And I got a pair of nearsighted glasses, and I became a memorizer in school. That's how I got through school. I got really good grades. I worked really hard. And every couple of years, my myopia got worse. I had progressive myopia. And I got to the point where I couldn't see the big E on the eye chart. And I was really dependent on my lenses. Well, after I graduated optometry school, I met a developmental optometrist. His name was Dr. Albert A. Shankman, and he practiced in Connecticut. I was living in Philadelphia at the time. So I started to go to him as a patient, and he said two things to me. He said, number one, I think your myopia, your progressive myopia, is due to tension that you've been carrying in your eyes since you've been a child. I'd never heard that before, even in optometry school. And then the second thing he said is that your left eye wanders out and you're not using your two eyes together. That's why you see double, and that's why you have poor reading comprehension. So I began working with Dr. Shankman in a process called physical therapy for vision. And about 6 months later, I woke up. I was rushing to my office in Philadelphia, and I'm driving on the freeway, and I'm going, oh my God, I forgot to put my contact lenses in, and I can see the road signs. I couldn't believe it. It was really a shocking moment, but it was amazing. It was an amazing healing. And I had been reducing my prescription, but this was amazing to be able to see clearly without my lenses. And we fast forward 40 years later, and I don't wear any lenses for distance or reading. So I experienced a shift in being able to completely reverse my progressive myopia. The second thing that happened to me was that I began to use my two eyes together, and I stopped seeing double vision, and I became a voracious reader. So, with those two things impacting me, in my practice that I opened up, and I actually affiliated with another developmental optometrist, his name is Dr. Ellis Edelman in Philadelphia. I started a practice where I was very inspired to help people improve their vision. But the problem was, I was in an area that was very allopathically centered, a lot of ophthalmology hospitals and clinics around our office, and I couldn't get any patients. It was very frustrating. So one day I went to one of the hospitals nearby and I met with the physiatrist and the physical therapist, and I said, I know how to do this rehabilitative optometry physical therapy on your patients. Could I come and try for 3 months and see if I can make any, improvements? So of course, after a month, these people who were suffering double vision, vertigo and balance issues, focus and concentration issues, these are people with traumatic brain injury, stroke, um, brain insults, all kinds of things. They were going back to their life in a normal manner. So I began then working at another couple of hospitals around Philadelphia, and that's how I built up my practice. The second thing I did at that time is I began to work with special needs kids. These were kids in the spectrum disorders, Down syndrome, minimal brain dysfunction, and I had a very strong impact on them, and I really helped them. So going after those two population groups, I built up a successful practice, which I sold about 5 years later, and I moved to my present home, Santa Fe, New Mexico, and I opened up a holistic integrative practice and, never looked back. Very successful at it. So that's my beginning. And now I want to bring you into what is exactly that I do. So before we get to that, I want to give a disclaimer that the information I'm sharing today is only educational, that this is not a substitute for medical care. It's not a substitute for your eye physician. This is just education. Okay. And so I am not diagnosing or treating in this. I'm only sharing information. I want to give a shout out to my mentors and my teachers. I have several of them in optometry and also in the world of body-centered healing, also in nutrition, craniosacral therapy, aromatherapy, and iridology. So really grateful that I had these people really touch me, and I wouldn't be here today without them. So I'm sure all of you have been to the eye doctor, and this is an optometrist, and he has a machine in front of the patient's eyes. It's called a phoropter. And you probably have been in this situation where your optometrist will put you in front of this and say, okay, which lens is clear, one or two? And you go, can you show me that again? And he says, one or two. And you go, I think number two. No, number one. I think number one. They're so close. So the optometrist will probably say, well, let me show you three and four. This is number three. This is number four. Four. I think four. And the optometrist may say, well, you're pretty definitive there. He says, well, I think I really screwed up because I still messed up because of number one. And so this goes back and forth. And let's say you're having a stressful day and you choose a lens. And then the next thing is you get the prescription and you go back to the doctor and you say, hey, doc, I'm kind of seeing out of a fishbowl. And he says, oh, that's normal. You'll just get used to it. And actually in 6 months, you'll come back and we'll make the prescription stronger and no problem. Or the other thing is you get the glasses or the contacts and you go, why is the world slanted? And the optometrist will say, well, that's just your astigmatism. Just tilt your head a little bit. You'll get used to it. And, in 6 months, you're going to get a cataract anyway. No worries. Well, no, we don't want to adjust and get used to something that's creating some kind of disharmony in us. And this is how the eye exams regularly go. So in mainstream eye care, it is dominated by reactive, symptom-based experiences. I'm sure many of you have had that. You have go in with a symptom and you leave and maybe the symptom's a little better, but you're not really getting to the root cause. And usually, whether it's, farsightedness or nearsightedness, myopia, hyperopia, astigmatism, cataracts, macular degeneration, dry eye, we're going to get into all those today. Eye care is very reactive, and they're going for the first line of defense. Okay, how do we control the symptom? They may manage the symptoms through prescription lenses, which, by the way, when you do get a prescription lens and you see 20/20 out of it, invariably it's probably going to weaken your eyes. And, in my practice, what we do is we figure out perhaps giving you a full prescription, but then we might give you a vision improvement prescription that you can work with in a non-demanding and non-threatening situation. And over time, your eyes can flex into the weaker prescription. It happens all the time for us. Also, in mainstream eye care, basically it's pharmaceuticals, needles, surgery. And, one of the big money makers today, if you have wet macular degeneration as an example, is the shots of Avastin, the anti-VEGF, and we'll go into some of those things. What are alternatives to getting the injections month after month? I've had a lot of patients over the years that have been doing those injections for a long time, and they'll come to see me, and within 3 to 6 months, using my method, they're able to completely get off the need for injections and their eyes get better. They return to health. Obviously, surgical interventions are very common, and sometimes you do need surgery. I'm not against cataract surgery. It's actually, one of the safest surgeries out there. But there might be alternatives that you can do that instead of doing surgery. So we'll go into that. The other thing that mainstream eye care does is it treats the eye as a mechanical structure, and it often ignores the deeper connections to the brain, to our systemic health, our trauma, lifestyle, and stress. One of the things that I did after I had my experience working in the hospitals is I published an article on research on the relationship between traumatic brain injury and vision. And by the way, if you want any of the citations that I shared today, I'd be happy to send you the article. My hair is a little less gray, but otherwise it is me. And the I would say the case histories that I shared were really compelling, and it made a big difference in terms of bringing traumatic brain injury into the conversation around vision. So, what is the science of holistic optometry? Well, there is definitely peer reviewed literature in vision science. The Journal of Behavioral Optometry, Optometry and Vision Development, have published many articles on case histories and outcome-based reports on things like visual processing problems, convergence insufficiency, which is an issue with coordinating your eyes together. It's what I had. So what is holistic optometry? Well, it considers the whole person. In this conference, and I've been listening and watching some of the other practitioners, they're all talking about, we're treating the whole person. We're reminding patients that we're already whole, and instead of treating fragments, we're treating the whole person. So in vision science, in our holistic optometry approach, I'm looking at things like behavioral neuroscience. We're going to do an exercise a little later in this presentation on how to increase our neuroplasticity. And because the eyes originate from the brain, the eyes are the only part of the brain that sit outside the cranial vault. But the eyes do come from the brain very early on in utero. So when we start applying new stimulations to the eyes, we can make changes. And some of those changes can really affect our behavior. That's why there's a term that's sometimes used in holistic optometry called behavioral optometry. And that means that if we change the way we're seeing, we might change the way we respond to ourselves and the world. And we'll talk a little more about that. Another thing that I do in holistic optometry is something called somatic movement, body movement. Well, we don't just see with our eyes. Our eyes are actually our GPS system that guide our body through space. And our peripheral vision, our depth perception, all of those skills that interface with the brain get stimulated through movement. And so movement and vision work hand in hand with each other. I don't know. I don't think I have to say much about nutrition. I mean, in this conference, everybody's talking about eating, in a healthier way. And certainly, if we change our diet, if we eat more antioxidants, the eyes have one of the highest metabolic needs of the body. And so, if we give it healthy, clean food, non-GMO, organic, we prepare it well, that's going to improve our eyesight, no question about it. Stress management is another thing. So, how many people here spend more than 1 hour a day on a computer? That in itself, being on digital devices, creates a lot of stress in our eyes and in our body. So, what can we do to reduce the stress, to de stress our vision so that we're not behind the eight ball in terms of oxidative stress, inflammation, and this creates the deterioration? You're in for a treat today because we're going to talk about light and color therapy, and I've set it up so we're actually going to all get a light and color therapy treatment. So that's going to come towards the end of my presentation, so stay tuned for that. And then finally, visual processing and integration therapies. I do this a lot with children. I'm in the process of directing and producing a new documentary that's going to be coming out this summer. And it's my work with the spectrum disorder kids that I've been, helping for over 40 years. And so, get on my email list because this documentary is really fabulous, and I've been working on it a long time. We're kind of in the final stages of it, but I want to bring awareness to the general public that vision and learning and the brain are very interrelated, and it can really affect our learning and processing of information. All right, some other things that affect our vision. I referred at the beginning of my presentation, astigmatism. And astigmatism means there's a twist in the body, a twist in the eyes, and this creates an imbalance in our posture. It's interesting with astigmatism. I'm a craniosacral therapist, and when I used to have my main office, I used to have my eye exam equipment, and right next to that, I'd have my massage table. So I would measure somebody's prescription, and then I would ask them to go on the massage table, and I would do an hour of craniosacral therapy on them. Then I'd put them back in the eye exam, and I would redo the exam, and invariably, their eye prescription was at least 30 to 40% less after doing an hour of craniosacral therapy. And that's what I would prescribe, and people were thrilled. They loved that prescription. So the point of it is that what prescriptions we have in our eyes can really impact our neck, our head, our body, our spine, our sacrum. And if we give a lens that's too strong, I'm telling you that the cervical spine, the thoracic, the sacrum, the pelvis is all going to feel it. And I've had a number of cranial osteopaths that refer patients to me because they say, this guy's prescription is way too strong. I can feel it in his cranial rhythm. This happens over and over again. So, posture, the body, how we hold ourselves, based on what prescription we're wearing in our eyes, it's going to affect our posture. What about emotions? Is there any relationship between emotions and how we see? Well, with 40 years of patients telling me this, so this is coming from patients, they'll say something like, my nearsightedness, my myopia is related to fear. And I'll then talk to farsighted people, hyperopia, and they'll say, my main emotion is anger. So if we relate that to Chinese medicine, what is fear is in the kidneys, and anger is in the liver. I'm going to talk about the liver kidney relationship in a little bit. So our emotional body definitely has effect on our physical vision. And once you start uncovering what's behind your eyes, what's been internalized, those things are going to start to come out, and you can have emotional, psychological, even spiritual insights that can actually clear up your physical seeing. I talked a little bit about learning. So we know that, when you go to the regular eye doctor and he or she has you read the distance eye chart, that's actually not vision. That's your eyesight, it's eyeballs, it's glasses. Vision is how the eyes and the brain and the body work together. So the more seamless you have that eye brain body connection, that's going to improve your learning. I mean, I experienced it firsthand. I was a terrible reader for 20 years. And when I met Dr. Shankman and I went through his vision therapy program and I healed my visual coordination problem, no problem in reading. I can read and write. And so it was a real epiphany in me. And again, over the years, helping thousands of kids regain their vision, which really impacts their learning. And then finally, the nervous system regulation. So our eyes reflect our sympathetic nervous system and our parasympathetic nervous system. So how does that work? So we have something in our eyes called our pupil, and the pupil is, I call it the light gatekeeper. Like, for example, you go outside and your pupils should get small. They should constrict because you want to protect yourself from the light. You don't want to have light sensitivity. Like you come inside and the pupils dilate because you need more light. Okay. So that's a nervous system, autonomic nervous system response. When you have too much sympathetic nervous system in your vision, guess what happens? Your pupils are dilated all the time. So you've got light sensitivity, you're sensitive to glare, you get eye strain, eye fatigue. Another thing you do is you tunnel your vision. This is the start of myopia. So your nervous system is a reflection of how your visual system is working and how you're working. You can't really separate it out. All right, a little more on research because people like that. And again, I can send you citations on the science of holistic optometry. The Journal of Behavioral Optometry has reported, improvements in convergence insufficiency by doing something called the Convergence Insufficiency Symptom Survey. They also do something else called developmental eye movement test. And eye movements are very important in terms of our reading, our tracking. And so there are physical kind of standardized tests that you can do to measure the effects of the physical therapy. And not only are you seeing subjective changes, but you're also seeing objective changes. Now, what about vision mirroring stress? I talked a bit about stress and stress management. There are scientific findings out there that the sympathetic nervous system is in overdrive. And just like I talked about, we go in our fight, flight, freeze response. This increases pupil size. If we're in chronic stress, it's going to affect our accommodation, which is our focusing muscles. Our vergence is our coordination. And the other thing that we measure is the relationship between visual stress and cortisol levels. We're not surprised by that. So we go into adrenal fatigue, and I'll kind of bring those things together a little later. How does vision mirror trauma? Well, in some of the scientific reports, early trauma can lead to disorganized visual processing. So this would be birth trauma. And any kind of C-section or breech or forceps delivery will affect something called primitive reflex retention. So now we're kind of in the world of occupational therapy and physical therapy. And I had the good fortune with one of my mentors, Dr. Albert A. Sutton, who was a world-renowned developmental optometrist. He brought a group of optometrists from Scandinavia, and they taught us the primitive reflex integration therapy. So the primitive reflexes are early movement patterns that start in utero, and they kind of set the stage for the infant, toddler, child to move through these primitive patterns, movement patterns, and then the brain gets freed up where they learn how to hop and skip and jump rope. And then eventually they're tracking their eyes, they have visual coordination. And then finally they move into executive functioning processing where they make decisions and they plan ahead, stuff they do in school. But what we learned was these school-age children that have learning problems, it was because they didn't integrate their primitive reflexes. This is what these optometrists from Scandinavia taught us. So what we found was is that if there was early trauma, could have been in utero, could have been at birth, could have been at the bonding period, these primitive reflexes got stuck and they're controlled by the reptilian brain, our survival brain. It's our survival response. And so by doing this primitive reflex therapy on them, it released the brainstem. They integrated the primitive reflexes. Then they could then move to the higher brain centers. And this actually had an effect on their processing. So it's a long answer to it's one way that you can heal trauma. Probably another way you can heal trauma that I use in my practice, especially with the kids, is craniosacral therapy. I feel that craniosacral combined with primitive reflexes is a really great um, foundation for helping children heal trauma. And I would say craniosacral works on the fluid body and primitive reflexes work on the nervous system. Now, the fluid body comes way before the nervous system. So, in a lot of rehab, they're talking about just primitive reflexes. They just stay in the nervous system. So in my practitioner training, as an example, we go all the way back to the fluid body, the cerebral spinal fluid, the fascia, the connective tissue, the lymph. Because if we can go all the way back, then we can reprogram the fluid body and then we can do the primitive reflexes on the nervous system. And there you go. You're covering all the bases. This also can be with adults. This is what I saw in the hospitals, PTSD and trauma survivors. I've worked with a lot of veterans, and in veterans, as you probably know, there's a lot of PTSD. And the thing about our vision is because it's soft tissue, we absorb the traumas, but we can't see them on the MRIs. We can't see them on the scans. But where I do see them is functionally, symptomatically. And so by doing, again, physical vision therapy, this is a way that you can start healing the PTSD and the trauma. Some other things that happen in trauma around vision is we tend to tunnel our peripheral vision. We have trouble with eye contact. We have trouble with convergence. That's where our eyes aiming in towards each other and focusing issues. And also the last thing is we're sensitive to light and there's a problem with our balance, our orientation. We might have vertigo. That's that vestibular visual mismatch. What about vision and inflammation? I'll tell you, a lot of the eye diseases I see are really related to inflammation gone amok. And if you look at conditions like dry eye, uveitis, macular degeneration, just to name a few, there's a connection between those and cytokine cascades. Also, oxidative stress impairing the lens health. So that's why we develop cataracts or retinal problems, either macular degeneration, diabetic retinopathy, or other very weird retinopathy conditions. There is a very strong gut-eye axis. I know that can be hard for some of my colleagues to understand, but the gut and the eye are very, very related and connected. So in my functional integrative body, my functional vision integrative body method, what I'm here to say is that functional means how we are using our visual system, as opposed to just looking at it from a structural point of view. When I was in school, I learned the structure of all the anatomy. And actually, in a few minutes, I'm going to give you a functional anatomy session. just to teach you a little bit about function as opposed to just structure. There's also, in my experience, a neuroemotional and a somatic approach. When we start adding those things to our vision, it allows us to open the door to create and treat the root causes, not the symptoms. And I would say most eye care is really interested in symptom suppression. They're not really looking at the root causes. So I think of it as education, prevention, and restoration, empowering people to take agency in their healing. And this is what our practitioners training is about. Okay, so I'm going to bring you into structural anatomy versus functional anatomy. And structural anatomy focuses on form and shape. This is the lens. This is the eyelids. This is the optic nerve. Okay. So there's an identification of here's the anatomical parts, and maybe this is where the disease is. This is where the disease begins. It could be in the optic nerve, it's glaucoma. It could be in the macula, it's macular degeneration. In functional anatomy, what we're interested in is how the anatomy moves, how it works. It's more of a dynamic situation. In this particular saying that I use, function affects structure. So how we use something is going to eventually affect the anatomy. As an example, a lot of people out there go into what we call invisible bifocals or progressive lenses. And when you wear a progressive lens, what happens is basically the edges of the lens are not usable. And the only part of the lens that you can see through is the middle part. And it's split up, it's a gradient where the very top fourth of the lens is for distance, the middle part of the compartment is for computer, and the bottom part is for reading. And let's say you now have been diagnosed with macular degeneration. This happens a lot in our practice. So they come to see me, they've got macular degeneration and they're wearing the progressive lenses. They don't like them, but they were prescribed for them. And what the progressive lenses are doing functionally is they're making the person focus and use primarily their macula exclusively. So they're making them use the weak part of their retina, but they're not even thinking, the practitioners that are prescribing these aren't even thinking of the functional ramifications. They're thinking of it as this is cosmetically great. Nobody's going to see the line. It's everything's in one lens. And, so they're not really looking at the root cause. They're just trying to treat, the symptom again. So we take them out of the progressive lenses. We might give them a single vision lens for driving and a single vision lens for the computer. And maybe we give them a reading lens as well. Okay, they can still use their progressive lenses if they're really shifting back and forth. But the key thing on function affecting structure, the bigger the window you look through, the more of the eye you're using. The smaller the window you're using, the less of the eye you're using, and you're putting stress, maximum stress on the stress point. It's the weakest part of the person's retina, which is the macular degeneration. So you have to look at what are you giving the patient as it relates to their functional vision experience. Okay, so here's the anatomy of the eye. And if we go over here, see my arrow, this is the front part of the eye. We have the front part, which is the eyelids, which protect the eyes and they house the glands. So people that have things like blepharitis or meibomian gland dysfunction, their eyelids are swollen. There's inflammation going on. And so, that's going to impede their ability to produce the proper tears that then cover the clear window of the eye, which is the cornea. And so the cornea has a lot of nerve endings on it. And if it's not getting lubricated every time you blink, it feels like you've got sand in your eyes. Well, the standard approach would be to use, an immune suppressant eye drop called Restasis, which is very expensive. It suppresses your immune system. It gives you some temporary relief, but it's certainly not dealing with the cause of why the person is getting dry eye, just as an example. And then we go behind that and we see the iris, which is the colored part of the eye. And then here's a healthy lens. So I read a statistic recently that by the age of 70, 95% of people are going to get cataracts. Okay, why is that? Why do we get cataracts? Well, partly it's because the lens of the eye has no blood vessels that run through it. You don't see any blood vessels here. It's what we call an avascular structure. And it's very susceptible to oxidative stress accumulation, protein accumulation, something called the glycation process, where glucose molecules attach to the protein molecules, and this creates the cloudiness in the lens. So, what can you do to reverse cataracts or slow down cataracts? Well, two of the main ingredients are glutathione and vitamin C, just to start with. We'll get into some other things, but basically, if you're developing cataracts, you're low you're low in vitamin C. And the third thing is you need to really monitor your pancreas health and your glucose levels. Because if your glucose levels are moderate to high, if you eat a lot of carbs and a lot of, white foods or sugars or, bad fats, you're going to start getting oxidative stress in the lens of the eye. So there are things that you can do nutritionally to start to reverse that. And we'll talk a little more about that. If we look back here, this is called the posterior chamber. This is where we get those bothersome floaters, eye floaters. I probably get a question a day on social media. How do I fix my floaters? And we think that floaters is just an eye problem, but actually there's a systemic and metabolic cause to floaters. Anything from inflammation in the eye, liver congestion, poor dentistry, head trauma, just to name a few. And so there's some things that you can do to mitigate some of the floaters. I think improving the lymphatic system is another way. Getting better circulation in the eye sometimes is a way to get rid of the floaters. And then finally, we're back at the retina, and the retina is made up of photoreceptors. We have the macula, we have which is right here, the fovea, and then we have the retina itself, and then we have the optic nerve here, and this is the connector back to the brain. So the eye in general needs a lot of nutrients. And after about age 35 or 40, we get less and less of those nutrients into that eye area unless we have really good digestion. And coupled with stress, poor lifestyle, lots of digital use, not getting enough morning sunlight. I mean, there's a lot of reasons why our eyes let us down. And there is a genetic component to it as well. So we'll kind of go into that maybe in about 5 minutes. We'll go into that. All right, so common eye conditions. I had progressive myopia and I was able to reverse it. Certainly, myopia is running in epidemic proportions because of all the screen time we're doing. I call it visual confinement time because we're so locked in up close. We've pulled the world in, we tighten up. And so then we get a lens which treats a symptom that corrects you for distance, but it just reinforces the myopia to get worse. Obviously, macular degeneration is the number one cause of blindness today, and more people are developing macular degeneration. We've got the dry, we've got the wet, and I would say that again, there's some very essential things that you can do to at least slow down macular degeneration. I've got some great research I'll show you in a few minutes that is groundbreaking in terms of really helping people. Obviously, dry eye is another big issue. I don't know whether you know this, but there's a very strong inflammatory relationship between dry eye in the eye and inflammation in the body. And, you know, obviously, eye drops are just a band-aid. They're not really going to treat the root cause, we really have to dig in and look at things like our thyroid health, our pancreas health, our adrenals, just to name a few. And maybe we actually have to improve our functional visual coordination through physical therapy. And maybe the lens we're wearing is too strong for us. Just as just a fast fact, when you go to the eye doctor and he or she gives you a prescription, so we'll talk nearsighted for now. If you're nearsighted and you get a prescription for distance and you try to use that prescription for the computer, it's too strong for you because the distance prescription is prescribed for 20 feet. So you'd want to ask your doctor for a reduced prescription that you would use at the computer. And probably you could just take your glasses off when you read. Now, on the far-sighted side, that's where you need the magnification. Let's say you have magnifying glasses that you use for your reading. That magnification power is going to be too strong for you at the computer. So let's say numbers-wise, your +2 magnification for reading, you should be wearing a +150, something less magnifying for the computer because it's further away. And a lot of people don't know that. And so they're wearing the strong magnification lens, both for their reading and the computer. And then they go back to their doctor and now they're having difficulty seeing in the distance. And now they need bifocals or trifocals. And it just starts you down that road of deterioration. And then we talk about glaucoma. Glaucoma is, I call it the silent thief, because basically what glaucoma does is that it robs you of your peripheral vision. And in glaucoma, you don't even know that you're losing your peripheral. This is why it's very important to go to your eye doctor regularly, and you want to get the tests of visual fields, optic nerve health, and eye pressure. And if it runs in your family, you want to, really take care about it. But there's some wonderful protocols that you can use to mitigate some of the glaucoma. Number one, um, boosting your omega-3s, because what a glaucoma attacks is your optic nerve health. So boosting omega-3, you could do the herb ginkgo, bilberry, taurine. Those are all really energy rich for the optic nerve. Bilberry is another herb that you could use that helps the retinal circulation. Boost your lymphatic health. There have been studies that show that jumping on a rebounder can actually bring your eye pressure down, getting craniosacral. Uh, you can get acupuncture. So there's lots of things that you can do to mitigate glaucoma, because really the only options are the pharmaceutical eye drops, which don't work that well, and then the eye surgery, which once you get the eye surgery, you're left with scar tissue, and then it becomes even more of a precarious situation. So to prevent that, to be more proactive, we tend to say, okay, let's do some of these therapies, and a lot of times we can start interrupting what the glaucoma pattern is about. So again, we want to treat the root cause, stress, trauma, diet, energy stagnation, look at lifestyle, nervous system reset, and vision practices. So I talked a little bit about the emotional and the energetic language of the eyes. And the eyes hold unspoken stories. When we start doing our eye dialogue, and we're going to do this in a little bit, you start talking to your eyes without your lenses on. One of the questions I love asking is, right eye, do you know you're married to the left eye? I remember I was teaching a seminar one time and I had this lady as a demo. And so I asked her right eye, do you know you're married to the left eye? And the right eye said, in name only, we sleep in separate bedrooms. I was like, whoa. And so what she was mirroring is her parents' relationship. So in Chinese medicine, the right eye is the father eye and the left eye is the mother eye. So it holds those stories. And especially once we're, adults, as kids, if we have nowhere to express this, we internalize a lot of our early experiences through our eyes. It gets absorbed in the tissue. Call that our inner vision. And when you go to the eye doctors, all they're interested is your physical seeing, and that's it. We're not delving into anything deeper than that. Because once you start internalizing these energies into your eyes, it is going to lead to tension. It's going to lead to fear, anger, fight or flight responses. I mean, it's one of the most unrealized tissues of the entire body. We're not aware of the tissue in our eyes. We just go to the doctor, we get the lenses, our tissue gets numbed out. We're not even touching our areas, our eyes, and you know, it just creates a real dead zone in us. Okay, so I want to bring in iridology. I don't know how many of you out there know anything about iridology. I'm an iridologist. I'm certified in it. I've studied it, and I use it in my practice. I take pictures of people's irises, and then we can really analyze the color and the structure. Because what happens in the iris is it's a map to the entire body. It's relating and showing us the physical organs and glands, shows us the systems of the body. It even shows us genetic tendencies and health nurture points. Now, in iridology, I never diagnose, I never treat based off that. It's basically just an educational and proactive way to see, okay, these are possible areas that need help. And the goal is to help people make changes in their health practices to maybe nurture, certain glands and organs more. I mean, we're not here in iridology to change the structure, to get rid of pigments, to get rid of, certain patterns. That doesn't happen in iridology. What we do is we photograph or we look, we analyze the iris as it is, and then we can make recommendations based on that. Our nervous system, our digestive system, our liver, our lymphatic, and I'll show you examples in a minute. Another part of iridology is called the RAID method. And in RAID, what we're looking at here is the personality and some of the deeper spiritual and emotional patterns in our eyes. So it's pretty cool. I mean, I really have a lot of fun with it. So I want to give a shout out to my teacher, Ellen Jensen. She taught me iridology. I got certified by her. And thank you, Ellen, for all your great work. And then her father-in-law, Bernard Jensen, he was, I would call him the father of iridology in the US. Amazing man, naturopath, chiropractor. He really researched iridology and brought it into the US in a way that, you know, it's an amazing way to read the body. I also want to give a shout out to Denny Johnson because he's the creator of the RAID method. You can go to his website, raid.com. Amazing guy. He's got some really interesting perspectives on the eye and the iris. So check him out. So this is an iridology chart. Thank you, uh, the Jensen family, Bernard and Ellen. So if we look here, this is the right eye over here. You see R, and this is the left eye L over here. And you can see how detailed this map is. So in the center, this is the pupil, okay, this black part. And what's really interesting is that if this pupil is not completely round, if part of it is shaved off or flattened, we actually can see in the spine where there's an imbalance. So the pupil on a nervous system level traces to spinal health, cervical spine, thoracic, sacrum. It's very interesting. Looking at the shape, you can see if there were back injuries, back surgery, just based on the shape of the pupil. And then the next layer out is the stomach, okay, right in here. This is our digestive area. And then we move out a little further. This is also our digestive area. Right eye and left eye a little different. One of the things I want to point out here is here's the liver over here and the liver over here. So a lot of times we'll see brown pigments there, which suggests that a person may need to do some nurturing of their liver. And of course, we know the relationship between the liver and eyes as it relates to acupuncture. But we're looking at all these different areas. Here's the respiratory area. This is, breast area, the lungs. So basically, when we look at the patterns of the iris, we map it here and we can kind of tell, is there a potential area that we can help? Obviously, the right eye also relates to father, grandfather, that history. The mother is the left eye, the grandmother. Sometimes we'll see patterns in the iris. And so we'll ask the question, did anybody in your mother's side have, say, breast cancer? Or on the father's side, did he have any digestive issues like IBS or Crohn's or anything like that? So we can sometimes pick up things that, the iris is going to show us. Okay, so there are three main iris constitutions based on the color. So if you think about what is your color, are you blue, are you brown, or are you mixed? Those are the three colors. So let's just, go through those for a minute. The blue-eyed person is a lymphatic constitution, meaning that they have to take really good care of their lymph system. So let's say somebody has a glaucoma suspect. A lot of times glaucoma and lymph go together. So we would be doing a lot of lymphatic things to help them stimulate their lymph. Uh, let's go through some of the things with the blue eyes. Number one, they might have more respiratory issues and mucus issues. They're tending more towards inflammation. Um, they can have connective tissue issues. They can have pancreas issues. Usually people with blue eye don't do well with gluten, dairy, and sugar. Those things are going to really muck up their glandular system. So, and then we can look at different, areas of the eye if we see pigments or different configurations based on a certain gland or organ that we want to look at. So some of the suggestions for blue-eyed people would be vigorous exercise, mini trampoline, drinking lots of purified water. Again, what I'm having with my patients, what we're doing now is we're doing either structured water or hydrogen water. I think it's very important to get your water tested to see what the baseline is. But blue-eyed people tend to be dehydrated, so they need to drink more. Even drinking with electrolytes is really important. As I said, mucus forms very easily with the blue-eyed people, so reducing dairy products. Like here's a connection in wet macular degeneration. A lot of times, if you have wet macular degeneration, you've either been exposed to mold or you have a dairy allergy. I remember I was working with a dairy farmer, and he had been getting injections for his wet macular degeneration for 4 years. He came to see me. He was crying. He said, I just can't do this anymore. And I said, what do you do for a living? He said, I'm a dairy farmer. I eat lots of cheese, lots of milk. I said, I think that the dairy is a big issue for you. And so he went off dairy. He really boosted his lutein, zeaxanthin, and astaxanthin. I had him do red light therapy. And within 3 months, his macular's healed. And he no longer gets eye injections. I see him once a year. He even goes back to the ophthalmologist, and the ophthalmologist will say, I don't need to see you back for about 6 months, which is like a win for him because it's like he doesn't even need injections. He's just going for the photographs. So the lymph system for blue-eyed people is really, really important. Again, hopefully you can get this slide. Fasting, we love fasting. We love doing raw juices, especially celery, beets, kale, ginger, turmeric. All of these things are really good. Doing a morning vegetable juice gets those enzymes into your body. It cleans the colon, the lymph. Now, if you've got a lot of respiratory issues, we'll use something like mullein tea, which is a great tea that cleans the mucus. So what we do is we have people make a hot tea, put that in their Vitamix, and then they can start throwing in their vegetables. The only fruits I would recommend would be possibly lemon, lime, grapefruit, and berries. So we're staying away from things like bananas and high glycemic index type fruits. Very important because sometimes they can spike your glucose levels, and this is going to wreak havoc in terms of your inflammatory response and other things. All right, now we go into the mix. This could be like a blue, green. It could be, a hazel. This person looks a little bit more brown, but when I show the brown, it's a dark brown. But this is what we call a biliary constitution. I would call it a light brown. These white or things here are called tophies, which suggests that, again, this person needs a lot of help in the lymph system. And these are these dark areas here. This is the digestive area. These are called crypts. So I would be asking questions about digestive problems with the parents. Because a lot of times there's inflammation or some kind of digestive dysregulation going on. And so we want to deal with that because the markings are there in this. So what we want to do is we observe this lighter pigmentation that's kind of a combination, but these folks need to really nurture their liver and gallbladder. And I talked a few minutes about dry eye syndrome, so this is where I want to really spotlight this. People will come to see me and they've got dry eye syndrome and they've tried a lot of different things, and they might even be at the point where they're taking really fancy, vitamin A, lutein, zeaxanthin. But the problem is that if our liver and gallbladder are not working properly, we're not assimilating our fat-soluble nutrients, which are vitamin A, lutein, and zeaxanthin. And I've had so many people with dry eye syndrome where we do liver cleanses. We help them absorb their fat soluble eye nutrients better. And guess what happens? Their dry eye goes away. And this is after years of getting things like lipoflow on the eyelids and Restasis and all kinds of, crazy things that they read on the internet or they try. So this is a really key point that even if you eat really healthily and you're doing a lot of, beta carotene, vitamin A, lutein, zeaxanthin, just as an example, um, if you're not absorbing these fat soluble nutrients, what good is it? Now, it could be because of inflammation. It could be because of, again, just liver congestion. All of us are overwhelmed today with the amount of toxicity in our environment. So I think doing some things around the liver gallbladder, and I'll go into some cleanses that we recommend, which are really gentle. Another thing that this biliary kind of mixed constitution needs to pay attention to is their pancreas health. And this represents, what kind of sugar sweeteners are they using? Again, I've done so many posts on social media around the death spiral of sugar in our eyes. And, people are really surprised that even in the foods, especially any processed foods, there's probably going to be some kind of sweetener or sugar in it. You really need to monitor your pancreas health. And I'm not talking diabetes, obviously, in wet macular degeneration, that's a pre-diabetic condition. So that's another area that I really, dive deeply into with people, because in wet macular degeneration or cystoid macular edema or any kind of macular edema, a lot of times it's related to pre-diabetic conditions. And this is why all these fragile blood vessels are growing behind the macula to try to feed the macula. When if you start moving off of dairy and sugar and gluten and reduce your inflammation, you have a chance of reversing the deterioration that's going on in the retina. Also in this biliary iris constitution, we've got gastrointestinal disturbances, like I showed you with that person with those black marks on the digestive area. And we really talk a lot about, is there constipation, is there diarrhea, is there flatulence, what's happening with their blood sugar levels and their liver gallbladder health. So here are some of the suggestions we have come up with that work really well for this mixed, and it has such a strong effect on the eyes by doing these systemic and dietary changes. So obviously, all heated oils, deep fried oils, eliminate animal fats and hydrogenated oils. And I want to make a comment here about vegetarianism, veganism, or animal products. And one of the things that I tend to look at is, what is your blood type? And your blood type is an indicator on, maybe I should have a little bit of grass-fed beef or organic chicken. I was working with a gentleman recently who was vegan for a long time, and he was getting really sick. And we looked into his blood, his he was type O, and so in type O, we found that having him eat a little bit of animal protein really turned things around for him, just as an example. So I think looking at your blood type is another way that you can decide, okay, how much plant-based, how much animal products should I even eat? Animal products. I mean, we have a lot of patients that do a lot of beans, legumes, which are great. And so, I think you need to do a really deep dive or get your doctor to help you decide, okay, what is the best choice for me in terms of my plant-based foods, my proteins, my fats. And, I'm not a cookbook person, so we work with each person individually based on testing that we do, and we look at what would be the best thing based on their iridology reading, their hair analysis, and other things. Okay, well, the rainbow diet is definitely in vogue still. So, increasing vegetable intake. I have here green, red, orange vegetables. Raw vegetable juices are super important as well. Plant enzymes first thing in the morning, I think, are great. Just use a hot drink if you want to. I think that a hot tea, a green tea, a matcha tea, a mullein tea, echinacea tea. One of my favorite teas is called oat straw. It's got a lot of silicon in it. It's great for the bones. It's calming. So again, you need to monitor how much sweet, salt, alcohol, caffeine that you're taking. So now, in terms of liver herbs that I love, I tend to like milk thistle, burdock, and yellow dock. Those three. Celandine is also another one. One of the easy ways to start cleansing your liver, there are three components. Get some warm lemon water in the morning. Um, for lunch, have some bitter vegetables. And then before you go to bed, you can put a little castor oil on your liver with a hot pad, like a castor oil pack. That's a nice, easy way for you to ease into maybe supporting your liver bladder a little more if you want to do that without going into some full-blown, liver formula or these herbal formulas. All right, the third constitution I want to talk about is the brown, dark brown, and we call this hematogenetic. And so when you have a dark iris, and I work with a lot of the Asian population, Native Americans, African Americans, they have like dark irises. One of the big issues they have is a blood issue. So it could be imbalance in blood composition, thick blood, definitely not absorbing their minerals very well. So I put them on a plant-based mineral regimen with B complex. This leaves a lot of stress. Like they are high achievers. They can work, but they don't rest. And so this begins to harden their lymph tissue. It usually affects them in the GI areas, creates inflammation, and again, liver, gallbladder, spleen, insufficiency. So to build the blood, greens, beets, blackberries, black cherries, red cabbage, grapes, just to name a few. Again, the raw vegetable juice. I think a Vitamix is a really great health device to have. I recommend it. Obviously, again, if you're not going to eat animal products, legumes, kitchery is really great. Getting fiber into your diet, also very important, and avoiding junk foods, eating a lot of fresh vegetables and a few fruits. Okay, so I want to move on to here's the RAID method, which talks about personality. Again, you can go to Denny Johnson's website, fascinating man, and you can learn more about the RAID method. I do iridology readings in my practice. We even do telemedicine iridology as well, and we do the RAID method, and we do, the physical analysis that I learned from Dr. Jensen. All right, so I want to move to something called neuroplasticity, vision and neuroplasticity. And there's research out there that under the age of 25, our neuroplasticity, our axons and our neurons, we can really change very quickly. Over the age of 25, we start to lose the neuroplasticity capability. However, we're not losing it in the sense that we don't have it. It's just we have to attend to it a little more. And one of my favorite books I'm recommending here is Breathe by James Nestor, because I want to bring in the conversation of nitric oxide. And I'm quoting page 223 of Nestor's book. Nitric oxide is a powerhouse molecule that widens the capillaries, increases oxygenation, relaxes smooth muscles. Humming increases the release of nitric oxide in the nasal passages 15-fold. The effects can be potent. So if you've got glaucoma, if you've got macular degeneration, if you increase your nitric oxide, you're going to create this vasodilation in the capillaries, the microcapillaries of the eye. And my favorite exercise that we're going to do in a few minutes, called the palm hum, is a way for you to automatically get more nitric oxide into your vision, your brain, and your body. There's a nice picture of our axons. So I talked about the neuroplasticity landscape. I look at a lot of research in neuroplasticity, and I have found that also trauma release, grief release, very important, to keep working on those things. But what I want to do right now is I want to show you this physical brain exercise that we do to stimulate neuroplasticity. We used it in one of our workshops. So the way this works is we can do this together. I want you just to read the words, okay? So I'll read the first line: red, blue, yellow, green, okay? So what I'd like you to do in the second row is read the color of the word. Okay, so that's blue, that's red, that's yellow, and that's green. Interesting. So a different part of the body. Now, the third row, read the word. And then the fourth row will have you read the color of the word. Now, if you would like this chart, the way you really get your neuroplasticity going in your brain is you do word on the first one, which would be red. And then on the second one, you would say the color of the word. So red, red, yellow. Now we're going to say the color, blue. Okay, so you alternate this. This is a great way to get both hemispheres of the brain working together, the corpus callosum, which connects them both. And it's one of our favorite neuroplasticity exercises that we do. We have several of them, but I just wanted to give you a taste of this. And by the way, if you would like a copy of this presentation, there'll be a way that you can contact me and I can send it to you in a PDF. Be very happy to do that. Okay, so experiential vision exercises. So we talk about eye muscle functional exercises. One of my favorites is called the hot dog exercise, and the second one is thumb scan. The third is eye dialogue, and the fourth is palming and humming, which works on our vagus nerve. So if you want more information on these, send me an email and I can send you directions on how to do them. They're really great for rejuvenating your eyes, especially after being on screens. If you feel like your eyes are getting worse, your prescription is getting worse, these are my all-star favorite exercises that will bring your vision into a better balance. Okay, well, here's the picture of the liver, and I want to talk just for a minute about the liver vision connection. When I studied acupuncture and Chinese medicine and functional medicine, I found that there is a very strong correlation. I've already talked about that. If a person has floaters, a lot of times they've got liver congestion, floaters, eye fatigue, blurry vision. The signs of liver stagnation and how to support it. We talked a little bit about a gentle detox, herbs, breath work is really great. But just going and getting some acupuncture could go a long way at, unstagnating the liver gallbladder, and your eyesight could really clear up. All right, here's the Mediterranean diet. I just want to touch on this for a minute. Studies have shown the Mediterranean diet to be very positive for eye health. And again, in functional nutrition, I studied functional medicine. There's so many different great things that you can do. What we like to do in our clinic is we either like to do iridology. I do a zytofacial scan, which gives us the circulation in the face, which can tell us give us a lot of energetic readings. The GDV camera, which was invented by Konstantin Korotkov, I actually have that camera, and that measures our energy fields, our chakras, and our acupuncture meridians. It's a fabulous test to see what's going on in our auric field, but it gives us numerical readings. And then hair mineral analysis, which tells us about, ratios of our minerals, which are our spark plugs. Great test to kind of tell us maybe what a person needs to do in terms of their eating. But if I had to say what are the key ingredients for eye health, lutein, zeaxanthin, astaxanthin, which is the marine carotenoid. We get that in wild caught salmon and pink salmon, pink seafood. Make sure it's wild caught. Obviously, omega-3, DHA, EPA, the trace minerals, zinc, selenium. I love turmeric and ginger root. We put that in our smoothies in the morning. Great anti-inflammatories. Turmeric, curcumin has been shown to help macular conditions, retina conditions. So, if you want to go on a curcumin supplement or do more Ayurvedic cooking, curcumin could be a way for you. That and saffron is also really good for macular health. Obviously, the rainbow diet, low glycemic foods, reducing inflammation, the eye gut liver axis. I love raw apple cider vinegar. You can put that on your salads. If you want to support your thyroid, seaweed, dulse, and kelp. And of course, looking at your blood type to see, what you should be eating. Okay, I wanted to just touch in on this. This is Dr. Jeffrey's study on red light. Most of you know about this. I talk a lot about the benefits of red light on our mitochondria in the eyes. Dr. Jeffrey's study found that over a 12-week period, the people that were in the study improved their visual acuity. These were people with macular degeneration. They reduced their drusen. There have been other studies that show that dry eye may be helped by red light. So you just have to find the right source of red light therapy for the eyes because a lot of the red light panels are just too bright. So you have to figure out what you might want to use. Contact us if you want a source for that. We're happy to help. But I want to tell you that photobiomodulation on the eyes really, really helps the mitochondria function and macular health. But that's only one form of color therapy. There's another form of color therapy called the rainbow method. And we're going to do this right now. This is a little bit of a meditation. So in a minute, I'm going to start with showing you the red color. And with the red color, what I want you to do is just receive it. Okay, we're going to go through the rainbow. So here is the first color. And what you're going to do is you're going to ask yourself, what color do I see and what color do I feel? Okay. You can cover one eye and see how you experience it through the right eye. You can cover the right eye and you can experience the red through the other eye. One of the affirmations I like to use on this is, I'm going to add a little sound healing here. This is called the So chord. We have sound healing in our office that we use. So here's the second color, orange. Again, you can ask yourself, what do you see? What do you feel? Here's the third color, yellow. If you don't like the color, it means you have a color allergy. So maybe you need more of this color. One of the affirmations I love using, I trust my ability to heal my eyes. I trust my ability to heal my eyes. I trust my ability to heal my eyes. Here's green. Again, it may not look green to you, but how's it feel in your body? Another affirmation is I see clearly through my eyes. I see clearly through my eyes. Then we've got blue. Breathe it in. Another affirmation is my vision is healing. My vision is healing. My vision is healing. And here's our last color today, violet. An affirmation is my eyes are alive and free. My eyes are alive and free. Okay, so as we transition, what I'm going to ask you to do now is I want you to rub your hands together, and I want you to take the palms of your hands and place them over your eyes and close your eyes. Okay? And then I want you to breathe in through your nose. And on an exhale, I want you to make a humming sound. Do that again. Breathe in. On the exhale, make a humming sound. And one more. Breathe in through the nose. And on the exhale, make a humming sound. You can drop your hands, but keep your eyes closed. And then you can open your eyes and you can come back to our presentation. So what we did there was vagal toning, somatic awareness, it's palming and humming. And my suggestion would be, instead of doing 3, do 10. Do 10 hums. And this is a great way to balance your nervous system, to bring your parasympathetic nervous system, which is our rest and settle state, into your eyes. Your eyes are like tuning forks. So the sound is going right into the eye tissue, and sound is one of the best ways to open up compressed tissue. And do this 3 times a day. This will really set the table for you to really help you get more circulation, oxygenation, hydration, and that nitric oxide, which is what Nestor talked about, 15-fold. You get that vasodilation in your capillaries, it starts to kick out the oxidative stress. And these are some affirmations that we use. I trust my inner vision. I see clearly through calm and present eyes. My visual system is healing now. So, embodying a new vision, my eyes are alive, adaptive, and free. My eyes are alive, adaptive, and free. I see life with openness and clarity. I see life with openness and clarity. So, some takeaways from today, I'm going to summarize. We're kind of at the end of our presentation. In my world, vision is a whole body, whole life process. The eyes reflect your emotional, nutritional, and neurological health. And you can heal your vision by healing your life. You can heal your life by healing your vision. So if you want to continue your journey with me, you want to go deeper, here's some ways that you can do that. You can become a member of my subscription, where we have online vision wellness platform, and we have lots of videos. You can join my 8-week functional vision certification course, my advanced functional vision and neuroscience. I'm doing a 4-day retreat in July here in Santa Fe. So if you want to come to that, get in touch with me. Or if you want to book a one-on-one vision session or an iridology appointment, virtual or in person, just send me an email. These are my books. You can get them on my website, the iSense book, Creating Your Personal Vision, which actually was my first book that I wrote, and a new edition. But then if you're interested in the work I do with children, treating the whole child, Taking It In is my book on digestion and nutrition, and my newest book, Vision, uh, Vital Vision. All right, here's a free offer. If you send me an email, I'll send you free access to my membership. You can look at part one of my interview and also get information. This great video is the most watched video on my membership site, Liver and Eyes. So if you either send me an email, or you can click on the link, and you get free access to my membership. So um, however you want to do that. And my final comment is the eyes are not just organs of sight, they are the storytellers of our ancestral history. There we go. So I think what we'll do now, we'll go into Q&A, if you want to do that, Michael.
Yes, thank you, Dr. Byrne. I really appreciate that. So,
Okay.
so I guess we know where your books are, and if somebody wanted to contact you, how would they go about doing that?
Uh, Appointments at drsamberne.com is the best way, or you can just go to my website, drsamberne.com. I'm all over social media, Facebook, Instagram, TikTok, X, um, YouTube. So there's lots of ways that you can find me. I have a podcast, so you can dial into that. That's on Spotify and Apple, and my website has lots of uh, free videos also.
All
Lots
right,
of ways to
great.
connect.
So in the beginning, you told a story about how you reversed your own myopia. Is it easy to most people's myopia? Is it easy to reverse?
Well, it depends on how long they've had it and how much myopia they have. It also depends on their lifestyle, their stress, and but all things being equal, I would say I have a success rate of about 95% of people having some reduction of myopia. Maybe not 100%, but slowing down the progression. I have a patient now who was -12, and now I have her down to -9. And so she's out of the danger zone of retinal detachment, uh, flashes of light, floater. She's an attorney. And so most people are, yes, they can improve their myopia pretty easily with me. How far you can go, is dependent on some of these other factors.
So through this talk, you showed a strong correlation between eyes and general health, right? It's how it's connected to various organs in the body, etc. When you fix the eyes, what are some of the other health benefits that you see as far as eradication of symptoms?
Less joint pain, less depression, more energy, more creativity. Um, I would just say a general openness to life and making choices in relationships, like I've got so many children over the years that when I help them improve their vision, it changed the course of their life where, oh, this guy's now a professor at MIT, or this person is a cardiologist, or this person is a social worker that is helping, indigents. It's amazing to me because I get these letters back from, and I've been doing this a long time. So these kids were 5, 6, 7, 8 years old, strabismus, lazy eye, amblyopia, and now they're adults. So I get to see amazing changes in how you change your life. I mean, the eyes are really a reflection of our soul and a reflection of our spiritual energy. I mean, I didn't really talk a lot about that because people are really focused in on the diagnosis. Oh my God, I have a cataract, I have macular. But looking deeper in, well, what am I blocking? What am I not seeing out of this side of my eye, my body? So if people are willing to look more deeply into what the physical is representing, then it unleashes some really big changes because it's perception, it's vision, it's how we see it, how we see ourselves. Um, so I don't know whether that's kind of nebulous, but that's kind of
No,
what I've
well, it's
observed.
an interesting topic. If you'd like to go into the spiritual aspect, I'd love to hear, maybe like a minute or so about, or a couple minutes about the
Mhm.
spiritual aspect and its connection to eye health.
Well, first of all, the eyes are an organ of light. Okay, so we obviously get light through our skin, but when we take in light through the eyes, there are non-visual pathways in the optic nerve that light is traveling through the bloodstream, first of all, through the blood. It takes about 40 minutes to go through the entire body, but it really activates our pineal gland, our pituitary, um, our hypothalamus, and our third eye. When we get into, the GDV camera and we look at the shot, you can actually see the chakras. You can measure the chakras. You can see where are the chakras lining up. It really comes down to how much light are we taking in and are we suppressing? I mean, there are different tests that we can use to see where we're suppressing visually, blind spots, or just shutting down an eye completely. And so, again, that third eye, the sixth, seventh chakra, one of the retreats that I used to lead, I don't do it anymore. For 20 years, we used to do wild dolphin swims in the Bahamas and also Hawaii. And so we would do meditation, we'd swim with the dolphins. I actually did research on how the wild dolphins affect our energy fields. And I presented that research at a conference in St. Petersburg, Russia in 2011 using the energy field camera. Um, so, the eyes reflect our Shen, our spirit. And you know how you have that saying, I see the light in your eyes. Well, that's, it's part of your spiritual energy. And what I think has happened is that the eyes have become a very um, weak area in our body. And even when I talk to functional medicine doctors and yoga teachers and somatic educators, they go, we do all this holistic stuff, but I've never heard of this around the eyes. And why? Why is that? You know, so I'm here to bring that into the formula of all your other speakers who are talking about holistic health. There's very few that are talking about the eyes. There are few, there's some out there, but the mainstream eye care is really entrenched in disease identification and drug surgery and needles.
So, speaking about eyes and yoga, I did do an exercise in yoga once, and I want to hear if this is something that you're familiar with, where you look to in one direction out of the side of your eye until you yawn, and then you do it to the other
Okay.
side, and then it's
Okay.
supposed to reset your nervous system. I don't know if you're familiar with that at all. I don't know if that's
Yeah. So, I mean, we can bring in, that's great. There's even something called EMDR where you're making eye movements in areas maybe where there was a trauma. But eye movements, we walk around like blinders, okay, because we're on our phone all day, right? So anytime you move your eyes, um, there's that opportunity where you're going to get more oxygenation and circulation in those eye muscles. There's six eye muscles that hold the eye in the socket and they move in different areas. So the more you can get the movement and you bring in, say, a standing pose, a breathing pose, absolutely, it's going to bring more chi to the eyes and the yawning, oxygenation, release, probably then more peripheral vision. Because again, when we're in our sympathetic nervous system, we're under stress, we're doing this with our vision all day, holding our breath. That's that sympathetic overdrive, fight, flight, freeze. So yeah, of course, it's why not? Bring it on.
and the humming in order to release the nitric oxide. How long do you have to hum for?
Not long. I mean, I think that again, my demonstration today, do three hums. It'd be interesting to poll people. Well, how do you feel after you did that humming for three? We did it after the color therapy, but you feel more refreshed. You again, nitric oxide. I'm sure many of your other presenters have talked about the vasodilating qualities of that molecule. Um, they're using it in glaucoma. They're using it in, all kinds of different health things. And Nestor has done a lot of research on humming and nitric oxide. Makes sense. So doesn't take much.
I've heard that in reference to rhinitis before, clearing
Mhm.
up rhinitis as well.
Mhm. Good.
Um,
Yep.
so now blue blockers. What are your recommendations for blue blocking lenses? And are the cheaper ones, are they effective? Like once you get on Amazon, and then especially with regard to cataract surgery, also.
Yeah, okay. Well, first of all, I've taken a step back from, endorsing any specific product distribution. But what I would say is that blue light is real. It's a neurotoxin, especially when it's emitted from screens, especially after 6 p.m. And I think go to your eye care professional, get a blue blocking filter. Tints, you need to be a little more careful about because that becomes a selling point. Get the day blue blockers, which are orange, and get the night blue blockers, which are yellow. To me, that's a sales thing. The people in the know in the optical industry, I mean, that are really in their integrity, there is a blue protection that you can get that, yes, it definitely deflects, and it doesn't deflect 100%. It deflects maybe 30%, 40%. Or you can get a shield on your computer, or you can change your phone setting and stop using the digital device an hour before bed and get out in the morning in the natural sunlight, which that blue light we actually need. Get your antioxidants, lutein and zeaxanthin and astaxanthin that protect your macula, especially if you've had cataract surgery, because the intraocular lenses, at least up to this point, have no blue protection. So you're more susceptible to blue light issues. But the regular mainstream eye care, it's very mixed whether they believe it or not. But I have done a lot of research in Europe And research here in the US, blue light is definitely a neurotoxin. And I would get something of higher quality just because it's your eyes, invest in it. So go to a private optical person who you trust, and then they'll steer you in the right direction.
And can mild to moderate cataracts be reversed?
In some cases, yes. It kind of depends again on diet, lifestyle, stress. We look a lot at the iris constitution and the pancreas health and the liver, gallbladder, thyroid. That tells us a lot whether the person actually has the capability to reverse the cataracts. But I think at the very least, if you increase your glutathione and vitamin C, and you cut out your sugar, you have a chance to slow down the progression of cataracts. And I'm here to say this, that cataract surgery is a really good surgery if you go to the right person. Now, I'll tell you a case history. I have a lady that came to see me the other day. She was nearsighted, right? So she could see well up close. She went to the cataract surgeon and he made her farsighted. So she has lost her near vision completely. She's completely disoriented. So in that particular case, oh my goodness, again, through physical therapy and other things, I'm helping her. But you don't want to do monovision. I would be very careful about doing like astigmatism, intraocular lenses, or monovision or bifocal. I get just the basic lenses that correct you for distance, that match you for distance, and keep you in the same refractive error. If you were nearsighted before surgery, be nearsighted after. If you're farsighted before, farsighted after. Um, so it's a full spectrum, but I'm here to say that yes, you can slow down. And in some case, I had an 86-year-old, she reversed her cataracts completely. She followed everything I did. She canceled the surgery. She sees 20/20. Her glasses keep getting weaker, actually, because her eyes get better. So, I have other people that we do the program and their cataracts get worse. So the healing is the surgery. So it's a wide range. It's really dependent on where that person's at in their healing process.
So during your talk, you mentioned that there is a correlation between the eye issues and I guess your emotional state, if I'm correct, or and there's a deep connection. What happens when you get LASIK surgery? I'm assuming you don't fix your emotional state. What's the relationship when you mechanically fix something like
So the mental emotional prescription is still there after LASIK. So it creates a mismatch. Okay, the eye optics is now nothing. No, you don't have it. But the mental emotional is stronger because that was the cause of the eye prescription. So what ends up happening is a couple things. The person just ignores the mental emotional, and the LASIK surgery keeps working. They start engaging the mental emotional, and the eye prescription comes back. So they need to go back either and get a re-LASIK procedure done, or they just start wearing glasses. There was an article in 2018 in the New York Times. You could Google it, FDA and LASIK surgery. And the guy that actually approved LASIK surgery says in the article, if it was now, I probably wouldn't approve LASIK surgery. I don't think it's a great thing. Dry eye, floaters, problems seeing at night. But millions of people get it. It's a quick fix. It works for a while, but it's not really dealing with the whole banana. It's just healing with the symptom of the eye prescription. So beware, if you do it, there's some things that you might have to manage down the road.
You mentioned that you are a cranial psychotherapist. What
Yes.
is that? What's
Okay.
the
I'm
modality?
not a craniopsychotherapist.
Oh, I'm sorry.
Craniosacral, Sacral. And
Oh,
so basically, this was invented by osteopaths, and it's a very light touch where we're feeling the cranial rhythm. That's the brain rhythm. It has a breathing capability like our respiration or our pulse, but it's how the cerebral spinal fluid is pumping into the eyes, down the spine, into the sacrum. So you palpate the body very lightly and you feel, okay, where are the restrictions in the bone movement, the lymph system, the fluid body, and then you help the person reset that. It's a very gentle um, therapy that creates more energy flow. Craniosacral is cranium to sacral. So that's what that is. Yeah.
Okay. And you also mentioned gut-eye access. Can you go more in depth on that relationship between I guess the gut and the microbiome and eye?
Well, first of all, the eye has a microbiome. And when you do lots of pharmaceutical drugs or eye drops, those kinds of things, you're destroying the microbiome in the eye. So you're going to have more eye infections and things like that. But what you eat, again, if we think about the eyes represent just the outside part of the brain, the book, the Second Brain, Gershon, who wrote that book many years ago, Michael Gershon, I believe. The same hormones, chemicals that are in the gut are in the brain. They also have an impact on the eyes. When I do iridology and I look at the digestive area of the iris and there's inflammation there, and then the person is saying, I've got dry eye, I've got glaucoma, I've got, and we clean up the inflammation in the digestive tract, guess what happens? The dry eye goes away, the glaucoma recedes. So I see it clinically where when I help heal the digestive inflammation, the person is doing the healing. I'm just, giving them the advice. I find that their eyes have less inflammation. That's how I see it clinically. So that's the
What's the
gut.
impact of, thank you. What is the impact of diabetes on eye health?
It's huge. First of all, if you've got diabetes or pre-diabetic condition, the blood vessels in the retina are going to be compromised. So there's going to be hemorrhaging. And there are different levels of hemorrhaging. There's the background diabetic, and then there's the advanced. So there's lots of hemorrhaging. And the other thing that the diabetes can show up in is macular degeneration, especially the wet kind. Um, so it's a really big issue. I living in New Mexico. I used to work for Indian Health Service, so we'd go out into the reservations, and all those folks had diabetes, and they all had diabetic retinopathy in the eyes because it's one of the areas because of so many blood vessels. The diabetes just kind of goes in the feet and it goes into the eyes. So it's a very serious condition.
So when someone has something like diabetes, do these modalities, are they more challenging for them to have an impact?
Well, it depends on their diet and lifestyle. I mean, I will give them red light therapy, which is really great for the eyes. We'll maybe do some kind of a liver gallbladder support. We'll feed them with good antioxidants. Um, And, the pancreas is the big deal. So I can see in the iris, what is the pancreas health and what is the genetic uh, tendencies in that. There's a product we use called berberine, which is very good for cataracts and diabetic retinopathy. And that tends to balance out the blood sugar levels. Just as an example, bilberry is an herb that helps improve retina circulation and retina health. So, there are things that you can do to slow down the progression. But man, if it's genetic and they're not cleaning up their diet, you're paddling upstream a lot.
And in behavioral optometry, how does the concept of vision differ from simply having 20/20 eyesight?
It differs because 20/20 eyesight is one aspect of vision. And 20/20 eyesight is about, what's the measurement of the glasses I need? What's the measurement of how my eyeball sees? Vision is really how the processing of information, the eye brain body connection. So it's a much broader part of what eye care is about. Eye care is about vision, eyesight and eyeballs and glasses is one component of that.
And do you have a thought on herbal eye washes?
Yeah. So in one of my conferences, like what you guys do, I did a couple on eyes. We had herbalists come on, and the herbal eye washes can be great. Golden Seal or Eye Bright. Eye Bright's kind of hard to get now. You can use an eye cup. So red raspberry leaf, chamomile, those are great eye washes. For sure. You can also do a castor oil massage on the outside part of the eyelids. Make sure it's hexane free, organic, washing your hands. But castor oil on the eyelids is very, very nice as well. Yeah, I go into the herbal eye washes a lot. They're great.
Could you provide thoughts on gazing that's become popular?
Yeah.
Is it safe and beneficial for supporting health?
Well, when we do our retreats in Hawaii, we usually go to a retreat center where we can do sun gazing, especially at the end of the day. I usually have people start off with their back to the sun or wearing a hat and just getting used to the sun's rays on their body. And then we work towards maybe the side where so they're not looking again directly at the sun. Their eyes are closed and the eyelids are like window shades. So some of the light is getting in anyway. If they do okay with that, then the next thing is when the sun is really low in the sky, their eyes are closed. And of course, we're having them move. They can do like a qigong or a swinging kind of a thing. That can be like sunning, swinging, and then so eyes closed is great. And then only the advanced students who've really been doing the sunning and are really, they've adjusted to it, will do it when the sun is really low in the sky or right at sunset. And we'll have them do it that way. But they still avert their vision, their fixation. So there are a lot of different ways you can get into sun gazing without looking directly in the sun, and you're still getting a lot of benefits. And it can be with eyes closed, and you don't have to look directly into the sun.
Blepharitis, what is good to clear that up? What describe what it is and how to clear it up.
Well, I just did a podcast on something called Demodex mites. And sometimes these little mites get in the eyelashes. This is where you'd need to get a diagnosis from an eye doctor. Do you have Demodex? Do you just have blepharitis? There are things like hypochlorous spray that you can get, or tea tree wipes that are for the eyes. Those are a good start. And then, you just have to see about your blue light exposure, and then what is your fat soluble nutritional absorption, your liver gallbladder health, your inflammatory response. Again, we might do red light on that, could work well. um, I find a lot of the ointments and eye drops out there are more symptom based, so again, we have to look more deeply into what are the causes of the inflammation, but certainly the um, the the tea tree wipes and the hypochlorous spray are things that people seem to get some relief of the blepharitis.
So, based on your personal journey, what's the most significant realization that you've had about the limitations of conventional vision correction?
Well, limitation. I think I think the doctors' indoctrination and their closed-mindedness. If they don't see it in their mind that there's possible healing, then they completely dismiss it. And I see the people that have been everywhere else, and I just shake my head every time because they're not open. Their prejudice is so strong, their indoctrination, their training, that they're not willing to look outside of the box or even make the connection of the eyes to the body. And 40 years, and every day when I see patients, it's the same story. I'm not being heard. I'm not being seen. I was told this. I was invalidated when I mentioned that. And here we are. We've got so many modalities, and all these people get better and better. And it's kind of like, but there's only one of me, so it's hard. That's why I'm doing the practitioner program because I'm on the tail end of my career, and I'd love to get some younger people. And they don't need to be eye doctors. All these techniques can be done without being, and probably better because the eye care education is so indoctrinated in eye disease that there isn't even a, even if there was like what Andrew Weil did in Arizona, where he had a program, they should have one optometry school where they're offering that kind of a program. I think that would be, because there's a lot of people on this call that are curious about the eyes, and I bet you they aren't getting this kind of information. So that's
Absolutely
my
not. So I
that's my
want to, we just have a minute left. I'm going to throw it out. We've had DA waiting to ask a question, so let's see what they have to say. DA, just real briefly, go ahead and ask your question. We just have a minute or so.
Hi, Dr. Byrne. How you doing?
I'm good, thanks.
Anyway, I thought you'd like to talk to the listeners about how EMFs affect the eyes. I don't think that was in your presentation.
Yeah.
And how castor oil could help with that.
Okay. So EMFs definitely affect your eyes. If you wear a metal frame, it's going to conduct EMF right into your eyeballs. So don't wear metal frames if you work on digital devices. Use plastic frames. I just did a post on social media and also my podcast on EMF and eyes. I think it causes floaters. I think it causes flashing lights. I think it dehydrates the eyes. So you need to take precautions around the EMF, even wireless. Now, in terms of castor oil, you can put the castor oil on your liver and then do a castor oil pack, liver gallbladder. That's great. Or you can massage the castor oil into the eyelids. It moisturizes, it's anti-inflammatory, and it's a great medicine that you can use to support your eyes.
Great. Well, that concludes our time. Thank you so much, Dr. Berner. It was an absolute pleasure to listen to you and learn from your experience. If we can unmute the audience, please.
You just said castor is good
Thank
for
you
your
very
eyes.
much.
For your
Thank
health.
Good
Doctor.
So you didn't say
Dr.
improvement in my
Byrne.
eyes. Thank you so much.
Very interesting.